I grew up in Galveston, Texas. Did some undergrad schooling out at the University of Texas in Austin. Went to medical school out in American University of Integrated Sciences. I graduated there in 2014. Then I started my residency training here at LSU in Shreveport. Spent 3 years here doing internal medicine. And then from there, I continued on at Allegheny General Hospital in Pittsburgh, Pennsylvania, where I finished my pulmonary critical care training. And now I'm back in Shreveport. I'm a pulmonary critical care doctor. It's a dual specialty. Half of my specialty involves diseases of the lung, which includes some diseases that you may have heard of, COPD and asthma. It also includes a lot of complex diseases like sarcoidosis, ILD. I also do cancer diagnosis and getting biopsies. That's something we also do in the pulmonary world. The other half of our specialty is critical care, in that we take care of the critically ill patients in the ICU setting who have very severe illnesses, who are really decompensated, and we do the best we can to try to stabilize their bodily functions and bring them back to good quality of life. In the pulmonary setting, I do a lot of general pulmonary medicine, lung disorder, COPD, and asthma that we've all heard of. I also like to focus a little bit on the cancer side of the patient. We've come really far with newer technologies now, so diagnosing these nodules early to figure out what they are and what they could be is something that does interest me, and that's something I do focus on in my practice. My philosophy has always been to just talk to the patients like they're my significant other, or they're someone I would want taking care of me, making an informed decision together, trying to explain things to them in a manner that they can understand. All too often we go through all this schooling and this training, and we sometimes forget that technical terms can, while they sound pretty normal to us, they can get a little out of the ordinary for everyone else. So just sitting down, having a conversation, laying out all the treatment plans, all the diagnoses, and then making a decision together is how I like to take care of my patients. The complexity of the patient care is something I do enjoy. A big part of why I went into this field was so I could deal with the complex patient. Also, it's really scary being in an ICU, not only for the patient, but for their loved ones. I like being a bridge for the loved ones to understand what's going on, to talk to the family members, and to let them understand exactly what we need to do to get their loved ones through this acute illness. Oftentimes we focus so much on the patients, we forget that their loved ones are just so anxious and so nervous that someone needs to really talk to them. So I like that I get to do that in such a setting that I can provide some relief for them.